In this video we are going to learn about midwives, who they and what work they do, and above all how to select a midwife. I hope you will find this video informative. You are requested to watch this video till the end. We really have some good information for you. If you find this video informational and useful, please give us a thumbs up and share the video with your friends. Kinds of midwives. If you'd like a midwife for the pregnancy, then there are lots of types you can select from. This will provide you different levels of attention. Accredited Nurse Midwife, CNM. A CNM is a healthcare professional greatly educated in how to take care of women and their infants. They'll encourage a woman during pregnancy, birth, and beyond. These midwives are nurses and also have gone through grad school. They are accredited by the American Midwifery Certification Board and are licensed in each state. Certified Midwife, CM. These kinds of midwives will also be healthcare professionals that will take care of a woman throughout her pregnancy and life for a mother. CMs aren't nurses, but they've finished graduate faculty in midwifery and passed on a certification from the American Midwifery Certification Board. All these midwives can give exactly the identical sort of attention to you, but maybe not all countries permit them. Certified Professional Midwife, CPM. The North American Registry of Midwives certifies all CPMs. Folks are able to choose the North American Registry of Midwives examination should they utilize a skilled midwife and finish a entry-level portfolio assessment procedure or grad from a midwifery school or application. But when the Midwifery Education Accreditation Council does not take the program or school, then the individual will have to complete the entry-level portfolio assessment program. Each state has different guidelines to get a CPM. However, overall, CPMs follow with the midwife's model of care. This version allows the midwife to 1. Maintenance for a woman's health and well-being from the start of pregnancy to after birth. 2. Confer girls to a obstetrician if desired. 3. Give each girl with personalized instruction, maintenance, treatment, support during arrival, and encourage. 4. Stay away from using maternity technologies as far as you can. Direct entry midwife, DEM. These midwives concentrate on births in your house or at freestanding birth facilities, or places to give birth not connected to some hospital. There aren't any national certificates for DEMs. Some countries have their own qualifications for direct entry midwives, and a few do not have any. Many DEMs operate for themselves, however CPMs, CMs, and CNMs may likewise be direct entry midwives. Lay midwife. This is really a midwife with no certificate or permit. They generally did not secure expert instruction but rather shadowed or researched by themselves. Some nations have a means to permit lay midwives and many others do not. Traditional midwife. These midwives do not get certified or accredited for spiritual, philosophical, or personal factors. Traditional midwives think their task is to assist the girls in their area with no law included. They view midwifery as a market between the mom. Traditional midwives believe all girls need to have the ability to select a fantastic midwife, regardless of their status. The way to pick your midwife. Midwives work together with you longer in your nourishment and instruction about pregnancy compared to a standard doctor would. They will concentrate more in your pregnancy trip overall than on regular checkups. They are more unique for your own pregnancy since they invest a good deal of time with you. When you select a midwife, it is important to consider what you are familiar with throughout your pregnancy. Ask yourself these questions before you choose one. 1. Would you need to give birth in a hospital or not? 2. Would you desire a birth which uses medication or minimum medication? 3. What degree of formal schooling do you need your midwife to get? In any circumstance, you need to select a trained and competent midwife to lead you during pregnancy. It is safe to use a midwife to your pregnancy provided that you do not have health risks that may influence your birth. If you are healthy and do not have some pregnancy issues, a midwife could be a safe solution for you through your pregnancy. But in case you have health problems like obesity, hypertension, diabetes, or are pregnant with more than one infant, you might just be eligible for a midwife should they operate along with a physician.